Welcome to vendorlink.ca. The following presentation will provide an overview of how the vendorlink.ca program works for your health system. We will discuss logging into the site for the first time, what information is required from each individual vendor, and how the vendorlink.ca system will give your health system peace of mind and a more productive workflow. So how does it work for the vendors? As mentioned before, the vendor registers online at www.vendorlink.ca. The first time a vendor logs into the site, they will be asked for essential information about their company, themselves, and their services. They will also submit individual representative information. You can now easily find your supplier's corporate contact information, as well as the representative that you know and trust. This also means that the vendor has created a virtual corporate passport. Then most importantly, each individual contractor, representative or supplier will acknowledge any hospital policies that you have. The vendor will then be able to upload any required documentation such as immunization certifications or training documentation, all of which will be managed through your personalized vendorlink.ca site. As the system is online, reps can register from anywhere where there is internet access and at any time. Registration only takes about 10 minutes, and it is a good idea for the reps to complete the registration before coming to your health system. All credentials that are duplicative, such as company corporate information, rep business details, workman's compensation, and background check, make up a rep's virtual passport. Other credentials, such as training and immunizations, vary from rep to rep, even within the same company. Therefore, it is important that each rep registers and can be tracked. For rep security and confidentiality, we never ask for social insurance numbers or driver's license numbers. You can ensure the effectiveness of the program by ensuring that any vendor rep you work with has completed their personal registration process. Your organization has dedicated a significant amount of time to develop policies to ensure that your patient's quality of care and confidentiality is respected. Your custom policies may not necessarily be shared with other health systems. To minimize the vendor's burden, each vendor on the vendorlink.ca system will be informed that your hospital is joined, so that they will not need to create a new individual registration. The vendor then has the choice to add your hospital to their profile. Earlier we mentioned that not all vendors are the same. The vendor rep that goes into the OR to observe and coach a procedure creates much more risk than a call centre agent who never comes on site. Your program reflects this. The greater the patient contact and the greater the criticality, the greater the degree of data credentialing and monitoring. Subsequently, less contact means less monitoring and a lower annual fee. At the beginning of this presentation, I noted that credentialing is different from access management. Your system wants to ensure that you are working with credible and valid business partners, both companies and individuals. That's why you have a credentialing program in place. Reps with access to patients must be credentialed for patient care and safety, but you also want to know which reps are visiting to help manage your costs and your operational efficiency. Rather than manage your reps and contractors by asking human resources or medical affairs to onboard, vendorlink.ca manages the process for you. The rep that drops by just because he was in the area interrupts workflow and increases risk to patient safety. Reps that sell directly to the staff can create payment headaches or drive up costs by buying off contract. This program is not intended to eliminate the importance of physician and rep interaction, but to help manage it and put it into context. Because of that, your program includes access management features in the form of badging. Access to your facilities will be managed by requiring visiting reps to sign in at selected locations or kiosks. When a visiting rep signs in, depending on your policy, the system will check for a valid appointment or prompt the rep to log in their appointment as well as current and valid credentials. Depending on the rules in place at your system, if anything is out of order, the badge may be denied or an alert may be printed on the badge. The badge is for one day only and must be generated on site. Think of the badge as an airline boarding pass. Your driver's license or passport presents your credentials that you are who you say you are, but you won't get on a plane without a boarding pass saying that you have a right to be here today. If your system requires appointments before badging, you'll be given access to the system and information about how to create appointments. Only hospital staff may create appointments. Vendors cannot do that. In summary, you are essential to the success of this program, and your participation is easy. First, keep in mind that this program is customized to your health system. Familiarize yourself with your system's unique policies, from parking to gifts and gratuities. Second, exceptions undermine the program. You can help close any gaps by only working with registered and credentialed vendors. Finally, while you're out and about in the halls, be aware of vendors and look for current badges. You should feel comfortable asking any vendor without a badge to go back and register. After all, this program has been designed in your patient's best interest. Thank you for your time today.